Hello everyone. We will be performing an implant exchange and breast lift surgery on a 50-year-old patient. This patient had a breast implant surgery 22 years ago. Of course, I wasn't the one who performed that surgery. Why am I mentioning this? Because even though it was done 22 years ago, there has been no problem. She has been going to her checkups and there have been no issues. Normally, the lifespan of an implant is around 10 years on average. But this patient has been using hers for 22 years without any problem. However, now she wants her breasts to be lifted. And since we are already doing a lifting procedure, we have to change the implant as well because its lifespan has basically expired. Her previous implants were placed over the muscle. Implants placed over the muscle tend to sag slightly over time due to the weight of the breast and the implant itself. This is completely normal. This is actually the main reason the patient wants surgery now. Also, she is 50 years old and has given birth. And of course, pregnancies naturally contribute to some degree of sagging. During the surgery, we will remove the old implant and replace it with a new one. She previously had a 230cc implant, and now we plan to place a 250cc implant. At the same time, we will perform a breast lift. Normally, breast augmentation is done through a small incision under the breast, but in a lifting procedure, there will be an incision around the areola, extending downwards and along the inframammary fold. This scar will fade significantly over time. There is also an asymmetry between her breasts. The left side is slightly larger and a bit more saggy compared to the right. I will try to correct this as much as possible. The surgery will take approximately 1.5 to 2 hours. Our aim is to achieve the lifted appearance the patient wants while also improving her result. With the new implant, we're about to begin the operation shortly. Yes, friends, the surgery is complete and it turned out very nice. Let me explain what we did. We mentioned that the patient had a 230cc implant, but when we entered during surgery, we actually found a 300cc implant. Since this surgery was done 22 years ago, the patient of course didn't have the implant card and didn't remember clearly. So she misremembered, which is understandable. It was a surprise for us. The implants were placed over the muscle. There was almost no capsule around the implant, but naturally over the years, there were minor deformations in both the capsule and the implant. Still, it was intact and could have lasted longer. It was a low-profile implant with a volume of 300cc. However, while the implant on the right side was intact, the implant on the left side had a small tear. When I squeezed it gently, I noticed a tiny hole, and some silicone started coming out. He hadn't had any issues, but honestly, the patient came just in time. Even if she had come a bit later, it still wouldn't have been a big problem. But I want to mention that there was actually a small tear in the implant. Even though I caused no trauma during the surgery, when I squeezed the implant, I noticed a small hole. We had told the patient that we would place a 250cc implant because she had said her previous implant was 230cc, but since we discovered it was actually 300cc, I preferred to place a 300cc implant again. I didn't want to go bigger than that. Next, we had to decide which plane to place the implant. Should we keep it over the muscle or move it under the muscle? I was planning to decide this during the operation. When I examined the area during surgery, placing the implant under the muscle made much more sense, because if I kept it over the muscle, there was a chance it would deform again in the future. Also, with implants placed over the muscle, the upper pole can remain empty, especially in patients who need lifting. An empty upper pole really affects the patient's satisfaction. In fact, one of the reasons she felt her breast was saggy was because the upper pole looked empty. When we placed it under the muscle, the upper pole automatically became fuller, and without damaging any tissues, I very carefully lifted the muscle. Of course, after supporting an implant for 22 years, the muscle becomes thinner over time, so I did this very meticulously without harming any structure. Then I placed the implant under the muscle. This made the surgery a bit longer for me, but it was much healthier for the patient. From now on, the patient will not have any issues with the implant, because the muscle will act as a good barrier. There will be no waterfall deformity, meaning the implant won't fall lower than the breast tissue. I'm confident about that, especially since we also lifted the breast at the same time. Previously, her breasts were very close together, saggy and stuck to each other. Now the cleavage area opened up slightly, not too much, but just as it should be. The upper poles are fuller and have a much more natural shape. I think the patient will enjoy these results for many years. It was truly a very successful operation. As we mentioned before, she will have an incision around the areola, extending downward and along the inframammary fold. And that's exactly what we did. There was no bleeding, and I did not use drains. I especially want to mention that our surgery lasted 1 hour and 45 minutes. I want to highlight that as well. Thank you.